Good afternoon. My name is Minh Quang Bui from San Jose. I'm support Senate Bill 969. Thank you.
My name is Sal Pham, President of the Vietnamese American Community at Coalition of Northern California. I support the Bill 969.
I am Tuyết Trân from San Jose. I am here with Overseas Vietnamese Women's Association. I support Senator Bill 969. Thank you.
Tôi tên là Lưu Quang Sang, cựu dân biểu Việt Nam Cộng Hòa. Hôm nay, đại diện cho người Mỹ gốc Việt tại Sacramento, tôi đến đây để ủng hộ dự án luật 969. Thank you.
Good afternoon. My name is Luc Quan Sang, and I'm here to support SB 969 from the Vietnamese community. Thank you.
I am Thai Tran. I come from San Jose. I support this bill.
My name is Khuân Nguyen. I'm from North Cal, Vietnamese American Communities and Coalition of Northern California. I strongly support SB 969. Thank you.
Good afternoon. My name is Phúc Ly. I come here from Vietnamese community in San Jose. Today I come here to support Senate Bill 969. Thank you.
Hi, my name is David Nguyen. I am the General Secretary of the Vietnamese American Federation of Southern California and a law student at University of California, Irvine. I'm here to support the SB 969. Thank you.
Hi, my name is Lynn with the Southeast Asia Resource Action Center, and we're in support of this bill.
I'm Nguyen Van Han. I'm here to offer my very strong support for Senate Bill 969. Thank you.
Maybe I'm the last one. I am Tom Winton, the engineer and also the owner of the business. I come here to support the Senate Bill 969. Thank you.
Is there any opposition to the measure? Mr. Chair, Justin Malone on behalf of the local environmental health directors, we did have an opposed position. Thank you to the author and thank you to your staff for working with us to take the amendment that we needed. So we are removing our opposition. Thanks very much. Thank you. Anyone else? Any opposition? Any questions, comments from the members? Seeing none, motion by Senator Mitchell. Would you like to close?
I just respectfully ask for an aye vote.
Thank you. We are at item number 2, SB 969, due passes amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Nielsen. Pan.
Aye.
Pan, aye. Roth. Wolk.
Aye.
Wolk, aye.
Currently has 5, enough to get out. We're going to put that bill on call. We're going to move on to item number 12, SB 1377, cognitively impaired adults, caregiver resource centers. Nguyen. Please proceed.
Thank you, Mr. Chairman and members. Let me start out by also saying that I accept the committee amendments that clarify the CRC services in person and also authorize the use of remote technology except for respite care services. I also again want to thank the chairman and the committee staff for working with us on those amendments. SB 1377 will increase support for much needed respite services for family caregivers. This bill will also statutory update the methods for delivering the much-needed supportive services to California's family caregivers. There are 11 community-based nonprofit caregiver resource centers CRCs, throughout the state that serve unpaid family caregivers of adults affected by chronic health conditions. 1/3 of all California households contain at least one caregiver who provides 20-plus unpaid hours a week. SB 1377 will restore the 11 CRC budgets by a mere $300,000 each to fund respite services at a functional level. As the state continues to promote home and community-based services and manage health care, unpaid family caregivers will be heavily relied upon by providers to help their loved ones navigate and make choices about their health care. Respite care provides caregivers a temporary rest from caregiving while the person who is being cared for continues to receive assistance in a safe environment. SB 1377 will also allow a CRC to deliver services beyond in-person meetings. Previous budget cuts removes CRC services in rural areas. The committee amendment addresses this issue. For all these reasons, I ask for your aye vote. I have with me here today Kathy Kelly from the San Francisco CRC and a national expert on family caregiving to testify in front of the bill. In support of the bill.
We have support on both sides. If we can just keep the comments brief, it would be appreciated. Please proceed.
Thank you. I'm here to just talk very briefly about the issues around technology, and my counterparts will talk a little bit more about respite. But I just need to say that throughout the history, and I've been present for the history of the CRC system since its inception, they're early adopters of technology, all to the aim of being able to serve more caregivers effectively and efficiently, but also to offer choices and options for people who are otherwise isolated by community or by their caregiving tasks at hand. It's also interesting to note that when we talk about caregivers, 2/3 of caregivers are under the age of 65. It's really the millennial, Gen Xers, and baby boomers who are the primary caregivers most in the workforce, not able to actually to participate in in-person meetings and go to conferences and other kinds of educational forums. We know that these caregivers, 86% of them have internet access, and they are searching for information on a regular basis. There's many different leaders in technology that can be pointed to, not the least of which is the VA, when their experience in managing very difficult chronic care conditions in the home by the use of technology and the support of family caregivers. But I'd also like to just address the issue of scale. It's one that we don't talk about very much, but at best, all of the kinds of programs that deliver discrete caregiver support services at best reach 2 to 3% of the population of potential caregivers in the state. So we need to do better than that. We need to be able to look at utilizing innovative technology means to scale some of our efforts in the areas that be most effective, and that, I would surmise, would be in being able to provide counseling, services, consultation, and also training on care and planning care and self-care demands on caregivers. We've seen a rapid increase at my agency in San Francisco. Over 10% of families now seek us out, saying that they were referred directly by a direct search on the internet. And videos that we have developed over the years looking at direct care schools have been viewed by over 250,000 individuals on our YouTube channel. That speaks to the needs of these kinds of programs being available on a little bit larger scale than what we're dealing with now. If we were to do those in in-person meetings, it would take 3,000 to 4,000 classes to do that. So I respectfully, seek your approval and support on SB 1377 and allow us to really intelligently look at innovative means to serving more caregivers in our present, in our state at this time. Thank you.
Thank you. The bill has been moved. We could please proceed. Again, support on both sides. Brief. Thank you.
Yeah, make it quick.
I would just simply say thank you. And just respite is so important. And to speak to that, we've brought one of our family caregivers here. So I will pass the torch to allow her to elaborate on the importance of respite care.
Well, my name is Juanita Turner, and I've been a caregiver for 10 years with my husband. And it's such a terrible thing. And it just makes you feel so really bad. It makes you feel hurt. Your heart just hurts to see them suffering, and there's not much you can do about it. But what I proposed to myself, that I loved the man, I respected the man, and I was going to give it everything that I had. And I did it for 10 years. My grandchildren, my children, even my great-grandchildren had gloves on trying to assist me. And my friends, they all assist me. Without them, I never would have made it at all. It's hurtful. It's just everything that you could think about, physically, mentally, socially, everything. It takes your life almost. You're consumed with the things that you have to do for him first. That's the way I was. And I have no regret today that I did it for 10 years. I was very happy that I did it after the fact that he passed away in February. And I would say, let your hearts be sympathetic to the people that have Alzheimer's, because it's really bad. The people you respected and saw them, they didn't complain. They go through, but they don't complain. And I thank God for myself being here among you to tell you, please pass this bill. The people with Alzheimer's and their families, the caregivers, are hurting very badly. They might not tell you, but I'm telling you, they're hurting. And I ask you, please pass this bill. Thank you.
Good afternoon, Bless Shepherd, representing the ALS Association Golden West Chapter. I want to thank the Senator for being our champion and just respectfully ask for your aye vote.
Thank you. Any opposition to the measure? Any support or opposition? Support. Please state your name and position.
My name is Jack Clyde. I'm the Executive Director of the Family Caregiver Resource Center in Orange County and the Traumatic Brain Injury Network, St. Jude Medical Center, and I support this bill. Thank you very much.
Thank you.
I'm Nancy Taylor, and I'm a caregiver and a client of the Mountain Caregiver Resource Center, and I please pass this bill because they have profoundly helped me through the years. I wouldn't have made it of 9 years of caregiving without them.
I'm Nancy Powers Stone, and I'm the director of Redwood Caregiver Resource Center. And on behalf of the family caregivers in my 7 rural California counties, we thank you for your support.
I'm Alexis Glidewell, and I'm a family consultant at Redwood Caregiver Resource Center, and I also thank you for your support on behalf of the family caregivers that we serve.
I'm Nancy Conchandani, and I'm a supervisor for the Mountain Caregiver Resource Center, and we cover 10 counties, and thank you very much for your support.
I'm Janine Spillman with Mountain Caregiver Resource Center, thanking you for your support.
Good evening. My name is Dolores Burnett, and I'm in-home support care provider, and I support the Senate Bill 1377.
Thank you. Any opposition? Questions, comments from any of the members? Seeing no questions, comments, who's been moved by Senator Mitchell. Please close.
I respectfully ask for your aye vote.
Thank you. This is item number 12, SB 1377, due passes amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Mitchell. Mitchell, aye. Monning. Nielsen. Pan. Roth. Wolk. Wolk, aye.
Currently has 4. We're going to place that bill on call. We're at item number 14, SB 1419, Galgiani Uniform Anatomical Gift Act, prison inmates. Both sides? We have support on both sides. Please
you.
proceed.
Thank you, Mr. Chair and members. SB 1419 would authorize a prisoner in the custody of the Department of Corrections to provide a form to allow an inmate to make an anatomical gift, and it would authorize the prisoner to make that election at the time of admittance into the state prison system or at a later time at the prisoner's request. The bill would establish a procedure by which a prisoner may revoke that election as well. The United States is currently facing a shortage of anatomical gift donors, with California making up 20% of the national donor waiting list. For the reasons I mentioned, I respectfully ask for your aye vote.
Yes. Want to ask a question now, or? Okay, go ahead. Well, I was going to ask, but there might be hundreds outside. So any support? Any opposition? Seeing none? Yes, Senator Mitchell.
Mr. Chair, Senator Galgiani, do CDCR inmates lose their right to donate if they've already checked it off on their license or have made it their wishes known prior to going into custody of corrections?
I don't know the answer to that question, but we're going to be working with Public Safety Committee to actually take some additional amendments to make it very clear that for someone who donates while they're in prison, that once they leave, it will be clear that they may still donate an organ.
Okay, so then my question would be if they have the little pink dot on their license, if once they go in, that's not communicated some way. Thank you.
Thank you for raising the question.
Okay, seeing no other questions or comments, would you like to close? Do
I respectfully ask for your aye vote.
we have a motion? Do we need a motion? Senator Wolk moves the bill. We're at item number 14, SB 1419, due pass to Public Safety Committee. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Nielsen. Pan. Roth. Wolk. Wolk, aye.
Thank you. That has 4. There's members absent. We're going to put that bill on call. We're going to go to item number 4, SB 1090, Mitchell, Sexually Transmitted Diseases Outreach and Screening Service. Senator Mitchell, I have a question. Where are we?
Senator Hernandez, it's 4:20 with Budget Committee having started at 4 o'clock, and you and I are still in 4203.
Thank you very much, Senator Mitchell. And we have support on both sides, Senator Mitchell. Please proceed.
I asked for your aye vote, Senator Wolk.
Okay, anyone would like to speak? Anyone like to speak in support of the measure? Please state your name and position.
That's where we're going. Oh, sorry. My name is Gary Richwald, and I'm the former director during the 1990s of the Los Angeles County STD program when we were fighting quadruple epidemics of gonorrhea, syphilis in newborns, and HIV. Also the co-founder of 2 community clinics in the LA area, and I teach STDs at UCLA and USC to future public health students. Throughout California, we call ourselves the California STD Control Branch, or in Los Angeles County, it's called the Prevention and Control Program. But the plain truth is, in 2016, we're neither preventing nor controlling most STDs in the state. If we were, I wouldn't be reporting today that we've had drastic increases of over 80% in syphilis, 65% in gonorrhea, 10% in chlamydia in women, and God only knows what the increase in men, since we don't do that much screening in men. And these increases are not just restricted to Los Angeles County, where we've had a 50% increase over the last 3 or 4 years, or San Diego with a 70% increase, but in the rest of California as well. Butte County has had a 400% increase. Fresno just reported a 1,600% increase in sexually transmitted diseases over the past 3 years. Santa Barbara, 200%. Santa Clara, 150%. These problems disproportionately affect communities of color, and they also are important fuel for new HIV cases. If you're infected with one of these STDs, your risk of acquiring HIV goes up dramatically. Why is this happening now? I think there are 2 reasons. One has to do with effort, and the other is where the spending on services go. The effort problem, the predicament we're in, is the California STD control program has a meager budget of $3.2 million, half from the state, half from the feds, to cover 38 million people. That's less than $1 a year for screening. It's not surprising that people can't do a very good job with that type of budget. The second problem has to do with where we spend our money. Now, the authorization I worked under in Los Angeles County was written almost 100 years prior to me being director of that program. That's how old STD control is. The fact of the matter is we need to work with new models of outreach and innovative, exciting, and new technologies that allow for self and home collection. Public health has begun to experiment with these around the state in a very successful way, and these are the types of programs that this bill authorizes. So what SB 1090 does, quite simply, is provide additional substantive direction to the California Department of Public Health to strengthen outreach through the use of innovative technology on the local level to stem the tide of these rising rates of STDs. Investments in STD control and prevention, especially using smart technologies and strategies, will save money and heartbreak for Californians and, of course, reduce the cost to state and local government. So I urge you to support this bill.
Thank you. Please proceed.
Thank you.
Hi, my name is Whitney Andron Cordova. I'm the Senior Director of Public Health for AIDS Healthcare Foundation. I will be very brief. We actually don't spend we spend less than $1. It's actually 4.2 cents per citizen for STD screening. That really is quite frightening, 4.2 cents per citizen. In finding new and innovative ways to help people know their status and get into treatment for STDs, for instance, there are some things that aren't expensive that can be done very quickly, up to and including looking at your status on an iPhone and being able to indicate that you're coming into the clinic to get treatment. That alone can save people a lot of time and a lot of money. We estimate we are using an electronic system, for instance, where people can get their results on their iPhones, and it reduces the time to treat by 2 to 3 days, which is significant. It reduces the time to people knowing their status by checking their results by 2 to 3 days. So and finally, if we use innovative approaches, for instance, the way it goes right now is people, if they get an STD, they get a call. If they don't get a call. So that's like good news. No news is good news. And so we really want to find a way to help people know, get treatment, and this bill helps us down that road. Thank you.
Thank you. Anyone else in support? Opposition? Questions, comments? Seeing no questions, comments, we have a motion by Senator Hall. Would you like to close?
I would just hope that the committee would see favorably upon my selfless act of not giving you my full, long, compelling argument, allowing Dr. Richwall, with his years of history and experience, to outline both the need and what this bill will do, and I hope that you will vote aye.
It's because you told me where we were this afternoon when I asked you where are we, that I'm going to support.
I aim to support my chair. I asked for your
the question, where are we?
Yes. It's a critical issue, and I hope that you will vote aye. Thank you.
I will vote aye.
Thank you.
Anyway, item number 4, SB 1090, passes amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Hall, aye. Mitchell.
Aye.
Mitchell, aye. Monning. Nielsen. Pan. Roth. Wolk. Wolk, aye.
Yes.
5-0, enough to get out. We're going to place that bill on call. We have some absent members. Item number 15, SB 1466, Mitchell. We have support on both sides, Senator Mitchell. Early and periodic screening, diagnostic treatment, and program
The first time, unlike some of my colleagues, I got you, Senator. I do want to clarify that the addendum that was handed out does show a support if amended by the California Labor Federation, and I'm not aware of the amendments, so I just wanted to put that out there. If they're here, they should come a-calling, because
we've never seen a letter or a late letter.
well, me either, so I'll ignore that. Again, thank you for the opportunity to present on SB 1466, which will expand mental health care access for foster children by requiring that existing screenings under EPSDT benefit include a screening for trauma. Very briefly, colleagues, the problem is that our state has a complicated delivery service for mental health products for a population who is especially at risk. Under current law, responsibility for providing mental health services is divided among 3 different systems, depending upon the severity of the diagnosis and whether or not the child is enrolled in managed care. What this bill specifically aims to do we also acknowledge the fact that state law and regulations also don't provide a clear definition of services, and therefore it's not always clear which agency needs to provide what services for this population. We've had numerous situations arise where foster kids have experienced treatment delays while the mental health plan and the Medi-Cal managed care plan decide which system should be responsible. So one point of concern for me is that as we go round and round trying to determine whether or not a child has mild, moderate, or severe mental health needs, we're failing to acknowledge that children who have experienced abuse or neglect and who have been removed from their parents are by definition suffering from trauma, which requires immediate and adequate treatment. And so this legislation recognizes child abuse, neglect, and removal from the home by a child welfare agency as evidence in and of itself for trauma. I appreciate the work that the committee has done with the advocacy community in identifying amendments that have been passed out to committee members that we are prepared to accept. Generally, the amendments define trauma for purposes of this bill, and I'd ask my expert witnesses here to provide their perspective.
Mr. Chair, John Bowders, one of the co-sponsors from Californians for Safety and Justice, along with our co-sponsors, the Youth Law Center and the California Youth Coalition. I'll be very brief and simply say, to echo what Senator Mitchell said, we ask for your support on this bill, and I will defer my comments to my colleague.
Thank you. I'm Lee Collins. I'm the director of the San Luis Obispo County Department of Social Services, the senior social services director in California by a lot, with about 33 years in the position. San Luis Obispo County has been dedicated to reducing the number of children in group homes, keeping children with relatives whenever possible, and ensuring that they have the resources that they need to be healthy. And I can tell you that in these 33 years of being a social services director, the biggest frustration for me has not been finance, it has not been arcane federal rules, it has always been the difficulty in getting mental health care for children in foster care. There's no question about trauma. According to the federal government, citing research, they stated that approximately 90% of children in foster care have been exposed to trauma. I think that's low. That's what their research suggests. My own observations would go along with what Senator Mitchell said, in that a child who has been abused and neglected and subsequently removed from the caretaker, even when that caretaker has been the one who has abused or neglected the child, there is trauma. By the time they are teenagers, according to other research cited by the federal government, 63% of children in foster care have at least one mental health diagnosis. 23% have 3 or more diagnoses. There is a early periodic diagnosis, testing, treatment services program, but the question that we always have is, where is the early in this program? Our belief and our observation is that children are not being screened appropriately. They are not being assessed. When they are assessed for trauma, there is not treatment that flows quickly enough or in an efficacious way. The state measures the extent to which mental health services are being provided to children with what they call the penetration rate. That percentage of children who have been assessed and diagnosed and are receiving services for mental health care. Statewide, that figure is 52% and has been in significant decline over the last 3 years. And remember, the feds say it's 90% who have suffered trauma. I believe it's more, and we're seeing a decline in the percentage of children who actually are receiving care. The actual numbers of children receiving care over the same 3-year period has gone up, with the exception of African-American children, where the raw numbers have declined. Services per child over this same period have seen steady decline. Therapeutic behavioral services down 16%. Basic assessment and therapeutic services for children down 9%. And even basic case management services declined over 17%. There is very wide variation among counties. The counties, if you'll pardon the pun, are literally all over the map in terms of that penetration rate. And there's no correlation between demographics or geography. It's just, it really seems to be a matter of practice and process by county. Those penetration rates range from as low as 12% to almost 100%, with that statewide average around 52%. And so it's not getting better, in my view. It's declining, according to the data. And I don't find it difficult at all to draw a line between the failure of a system to identify and treat trauma early on to the point where untreated trauma begins to manifest itself in behaviors of youth, to the point where the system concludes that the best means of addressing that trauma is through the use of psychotropic medications. I want to recognize Senator Hernandez for your role in having the hearings that brought that to light. So we need to start earlier so that we're not getting to the place where untreated trauma leads to an overprescription of psychotropic medication. And really, this is our opportunity. We have a chance with the implementation of continuum of care reform, which represents the most comprehensive change in the system of care for foster children in a generation. And I know because I was there for the last one. The focus on family-based care rather than congregate care assumes a radical change in our approach with youth. Instead of sending children to where the services are in group homes, knowing all that we do about them, we propose a change, or we anticipate a change that brings the services to the children where they are, whether it's in their own home, whether it's in the home of relatives, whether it's in a foster family home. But the idea is to bring that specialized care home to the children. And my observation is that the system's not prepared to do that. So I welcome the oversight envisioned by Senate Bill 1291, which you heard earlier today. I welcome the discussion on psychotropic meds and note that many psychiatrists have said that they do this because it's their belief that there aren't alternative therapeutic services available. And I particularly welcome the changes envisioned by this bill that recognizes that there is trauma. It must be screened, it must be assessed, and it must be treated before these children end up in much worse health than they are. I would say in closing that we have, in San Luis Obispo County, according to our model, we have moved 173 former foster children into college. We have a program that's unique to San Luis Obispo County. We are firmly dedicated to ensuring that there are better lives for youth when they leave care, but it has to begin when they enter care. Thank you for your support of Senate Bill 1466 and for your attention today. Thank you, Senator Mitchell.
Thank you.
Mr. Chair, Frank Mecca with the County Welfare Directors Association on behalf of the 58 county human services agencies, including the one in San Luis Obispo, and we are in support of this bill.
Thank you. Anyone else in support? Please state your name and position.
Tan Law with Health Access and Strong Support. Linda Way with Western Center on Law and Poverty in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Vanessa Hernandez with California Youth Connection. CYC is proud to support and co-sponsor this.
Les Shepard representing the American Association for Marriage and Family Therapy, California Division in support.
Lynn Thal from California Alliance of Child and Family Service in support.
Jessica Haspel with Children Now in support.
Robin Goldfaden with Youth Law Center, a co-sponsor of the bill and in support. Thank you.
Thank you. Any opposition? Questions, comments? Seeing none, we have a motion by Senator Wolk. Would you like to close?
Just very briefly, I want to thank Mr. Bowders, Mr. Mecca, and Mr. Collins for coming today. And what I couldn't find before, I had too many papers in front of me, Mr. Chair, was just the definition for trauma. Again, we've worked very hard to make sure that the committee will be comfortable with the goal of this bill. And I think we've reached that with the mock-up amendments that I hope members were able to find easier than I was able to find my own. And it's a very critical issue. Children who've been removed from their homes have been found to have experienced twice the rate of post-traumatic stress disorder than a war veteran. And early screening and detection and making sure they get in the right mental health, early mental health services is our responsibility as their caregivers, as legislators. So I ask for your aye vote.
Thank you. We have amendments to be taken in the next committee. This is item number 15, SB 1466, due pass to Human Services Committee.
Thank you.
Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell.
Aye.
Mitchell, aye. Monning. Nielsen. Pan. Roth. Wolk. Wolk, aye.
Currently has 4. We'll place that bill on call.